Well, the first thing I seen you reply where I seen what your job was, someone had asked me, do I think personal trainers can lower the rates of obesity? I don't know if you remember that.
It's an interesting question.
So someone was like, because quite a lot of personal trainers are getting loads and loads of views, say, and they were like, do you think that can impact the obesity rates? And I'm quite cynical. I mean, I'm a Glaswegian.
I would say no.
So that's exactly, mine was more about absolutely not. Mine is a hard no. What do you think is because you work in that field, what do you think is contributing to the rising numbers of obesity the most? Because some people are like laziness, and I was like, we've not just randomly got lazier over the last like 30 years.
I mean, none of the answers I have to this will be particularly particularly new. I'd say that certainly amongst people who, and remember Jack Monroe. Have you come across Jack Monroe? No. It's one of the writers. Let's come back to Jack Monroe. The reason is I'm going to have to check their pronouns before I mention on camera what the pronouns are. Cool. So Jack Monroe said something really profound, where they said that if you don't have a lot of money and you've got a child and you want to reward them, then one of the things you can do is give them sweets. You can give them, it's a way to reward. You see them excited, you see them happy, you've rewarded them. And it's, if you don't have a lot of money and don't have access to a lot, that's one kind of way to do a kind of reward or withholding for punishment that may not be the case, if you had more money for PlayStation games or whatever. That's a tiny microcosm of it. But I think certainly when you look at the preponderance of kind of calorie dense foods that are available that are cheaper than good food choices, like I know I sound like a wanker when I'm saying that, but like but that sort of the fact that, and if you've got food insecurity, if you're living paycheck to paycheck, and then you've got,
which most of this country is, you've got
McDonald's in the street that's doing, I don't know what the cheapest burger at McDonald's is these days, but it's the access to that kind of food, that kind of really not great high calorie food, and there'll be an education component there as well. I think class for sure has a big thing to do with it, and the economic conditions of the country, and just the general instability that people have growing up. So, and there's all kinds of things going on there in terms of your family relationships, which you've talked about, and the kind of economic instabilities that can affect family relationships. Access to high calorie foods as well, that are cheap. And I mean, I think that per calorie, I think it's, that your good food calories, as it were, cost much, much more per calorie than they do for your kind of junk food. So these are all things that are contributing kind of to it. I don't think it's because people are getting lazier.
I don't think it's that at all. It's obviously multifactorial.
For sure.
Obviously, there's not just one. Because there's no study on this. How can you study what is causing higher rates of obesity? You can't just do a study and like, oh, it's that. But if I was just to hypothesize on the biggest factor, I would say it's the access to processed foods and the fact that these are billion-dollar companies or billion-pound companies, whatever. And that's why when someone asked me that question, I was like, we're personal trainers off our own back, just making videos and hoping we somehow say something in the first 5 seconds that you're not interested in to listen to us. Competing against billions of pounds, trying to get you to eat processed foods, and it's cheap. Whereas what I want you to do is lift weights. How am I going to win that? How am I going to win that battle?
Also, there's a cost to lifting weights, right? I mean, you got a gym membership, you got a personal trainer cost. It's by and large a middle class kind of thing. And
never thought about it like that. Definitely.
But it's and like, I know one of the things again that I thought that you did was very good is you're like, look, if you can't afford me, it doesn't matter. Like, I've got just do something. I've got training plans here for free. Download them, get started. Like, it's not. I know you're selling a service because you need to make a living, but at the same time, you're also clearly trying to extend that olive branch to people who perhaps.
Well, I wrote down. I've got a whiteboard in my room, and I wrote down. I feel weird when people are also like positive about me, but I just get this cringe thing.
You're blushing.
I wrote on my whiteboard to just like make the gym as accessible as possible for people. And that's why it's hard to do it on top of everything else, but like I want to make more free plans and stuff like that. And they're always in my bios. They will get an email sequence that'll tell them about my coaching, but they can use that, and they can use I've got maybe like 15, 20 solo podcasts that is just like the pure lifestyle advice. And since I started doing them, I get a lot more messages of people going, that really helped me, rather than like 30 seconds on an Instagram reel.
And do you find that a lot of I follow a lot of kind of personal trainers, not mean to cheat on you, but I follow a lot of personal trainers on Instagram.
Get them unfollowed.
But one of the things is that a lot of the very good ones, they're clearly angled at people who are already very good at lifting. They've already got, they've already got quite a lot of experience, or they're quite athletic already. So it's about hitting that balance for people that have no experience at all.
I honestly don't even want to work with. I want to work with people that have never lifted before. That's who I relate to the most. I relate to people that have the same upbringing as me, or that like same sort of experience as me, like where it's like they're actually nervous to be in the gym. They don't, as soon as they start lifting weights, get ridiculous results. Do you know what I mean? That's more who I want to. I just found it interesting with the people think because you were like, you still need to make money at the end of the day. Do you think there's any possibility of like NHS and personal trainers working together?
Well, we should probably caveat this with this isn't set up, and I'm not recruiting for NHS Grampian here. but yeah, I mean, it'd be good. I think that certainly the physiotherapists, they do a lot of kind of rehab weights. We've got a gym in the hospital, but it's really for patients who are like, who are requiring rehab for whatever reason. I think we would all like to have a situation where that we could increase the access to exercise as well. Because the thing is that we don't, as far as I'm aware, we don't have, it's not like I've got a physical therapist on staff that works with us in the bariatric service to teach someone how to bench press or fill in your exercise there. And there's other things. It's the problem with the NHS, as you'll be aware, is that like the demands on the service are colossal for the money pot that's kind of there. So a lot of that's going to be resources. In an ideal world, I would love for us to be in a situation where we could expand the service.
Yeah, everything you're talking about is like, but like it's so hard to do so. Because I was thinking in my head, I was like 80% of PTs don't make it past the first year. There's a lot of, because I think within just weight loss in general, they have to get out of just the scope of it always being fully qualified people, because they need more help than the amount of people that are like qualified doctors, etc. Do you know what I mean? Like doctors are already stressed.
I'm not qualified to teach anyone how to bench press. Do you know, like I'm qualified to basically look after their medical health. And so it's an entirely different set of skills. It's like me being great at table tennis and switching to competitive swimming. Like it's an entirely different set of muscles that you use for those kind of things. And I guess that's the interface about what you're asking me, that kind of interface between, there's this suspicion of bariatric surgery. It's an easy option. Like, you've had clients that have thought that I don't have to, I'm assuming you have, that I don't have to lift weights. I can just get a sleeve. I can get a Rouen wine in Turkey or wherever they go abroad to get it done, and that'll fix everything. And it's not, you can do that, but there's risks attached kind of to it. So I think we both agree that if you can avoid having to do it, then that's probably the best thing. Like,